Hello, everyone, and welcome to our broadcast. I am your host, Kayla Lounsbury Robertson, Executive Director of Marketing and Digital Experience here at Providence. Joining me today to discuss the healthcare workforce crisis and what digital might do to help is Matt Cohlmia, Executive Director of Digital Strategy at Providence. Welcome, Matt. Good to have you here.
Thanks, Kayla. Good to talk.
Yeah. All right. So before we begin, just want to share a quick reminder that the information provided during this event is for information purposes only. For any medical questions, please reach out to your primary care provider or healthcare professional. All right, with that, let's get started. So Matt, you and team recently put out a report around, this workforce crisis and what digital can do to help. And we all know that healthcare has been facing this crisis for quite some time. Over 500,000 people have left the workforce since 2020. And it's a topic that's, leading plenty of press headlines. And, it's something that's also closer to home, as our CEO, Dr. Rod Hochman, has talked about this a lot. And it would be easy to just, assume that this is directly connected to COVID, right? But some of the findings in your new report suggest there might be other factors at play. Can you talk about that?
Yeah, absolutely. Burnout has been a challenge in healthcare for a long time, and folks in the industry know this. They've seen it firsthand. Even before the pandemic, it was the topic of conferences, and it kept executives up at night. We already had, between physicians and nurses, the number one and number two highest burnout rates of any profession. It was bad, and maybe it didn't make CNN headlines, but it's certainly been relevant in healthcare circles for a long time. And I think we tipped from bad to crisis mode pretty quickly with the pandemic. I think the stat was that I just read, not in the piece actually, but is that 40% of providers reported being burned out before, which already was highest of any industry, and now it's 60%. 1 in 5 doctors and 2 in 5 nurses say they plan to quit the profession within the next couple of years. So that, combined with aging baby boomers, we're expecting a pretty severe crisis. It's gotten pretty bad pretty quickly, and health systems in particular are struggling to find ways to manage.
Yeah, and I think I remember reading in the report that, for those citing the feelings of burnout today, it's not even COVID related that they're citing is driving these feelings for themselves.
Absolutely. It's interesting. And I was surprised by the data myself, but sorry, we have a 8-week-old in the background here.
Yes.
I was surprised by these numbers too, but most providers don't say that COVID is the main reason for burnout. Most providers don't say that the nature of practicing medicine is the reason for burnout. A lot of them cite their administration, the organizations they work for, the sort of day-to-day tasks that get in their way or are challenging or frustrate them. It's not a sort of existential pandemic crisis problem. It's a really day-to-day challenge that a lot of our providers feel. So the solutions will have to similarly be day-to-day, we think. COVID, as it subsides, which, by the clock has been going on for a little too long now, and I think we're having another surge. But even post-COVID, I don't think we'll see this get alleviated super quickly.
Right. So knowing that these challenges aren't necessarily new, but definitely worsening, can you talk about where there are opportunities for digital to help?
Yeah, sure. So in the piece, we break out sort of 5 categories, and it's hard because this spans so many different parts of these jobs, but we sort of picked 5 categories. So one is self-service. So where can patients self-serve to take burden from our care teams? And this is, in the right circumstances, a total win-win, right? Nobody books, well, not nobody. Most consumers can book restaurants online now without talking to a person. You can book a flight, you can deposit a check, and these are not done out of pure cost savings. These are better experiences for the consumer. So this is a total win-win. And where that's a better customer experience, healthcare needs to catch up and provide those kinds of services, especially in an industry where we notoriously have long wait times. You can sit on your primary care with the phone ringing for a long time before sort of getting a response. The phone tag is really frustrating. Not known for great customer service, so we can leapfrog that to provide great self-service when possible. So self-service is number one. Second, when self-service isn't really an option because it's not a kind of win-win in those cases, where can we help care teams by automating that task so that we're getting rid of some of that rote manual labor? So revenue cycle, we think, is a huge area for this. Notoriously complex, notoriously task-oriented. And within that, we think there's a huge opportunity for technologies that can help bridge data gaps between payers and providers to create interoperability, and then we can use that interoperability to power automation of some tasks. So a lot of cool opportunities there within taking tasks that could be automated and automating them will require a good data interoperability, which I think will be a huge step. The third is clinical assistance. So if it can't be self-service, can't be automated, how do we just make that task easier? So maybe our most promising example of this, which I think we'll probably talk about later, is some work we're doing with nuance and AI scribing. So patients and providers have both long been frustrated that screens kind of get in the way of care. You'll go to a primary care visit and your doctor will spend the entire time staring at the screen. Doctors don't want to be staring at the screen either, but because of coding and billing and all the notes that they need to take and all the templates that they need to fill out, they're really kind of glued to that. So how can we use technology to sort of reconnect the patient and provider and mitigate some of that screen time? So the fourth one is new care models, new disruptive care models. So all the areas I've already mentioned are super important, but they all sort of it's sort of the faster horse model. These are things that take the same bolus of work that we have today and shift it around to more efficient ways of executing, and that's super valuable. But new care models, especially those enabled by value-based care, can change the way that we provide care at a more fundamental level, to the point where we're not sort of taking a giant checklist and having to go through all the pieces. We can stop, set the checklist aside and say, what do we need to do to take care of this patient? What is the fastest road to get there? And if we can skip steps to deliver the same quality or better quality care, let's go do that. So we need to flip the model away from fee for service in order to do some of these. But with that model flipped, there's a lot of opportunity for care models to spend more time just working directly with the patient and less time on sort of rote administrative tasks. The last bucket is just caring for caregivers, mental health services, crisis hotlines, but also just normal sort of workplace hygiene. So like good management and career development and good career ladders and good opportunities to do the kinds of work that people love and position their careers for growth and a good trajectory. Healthcare has not always been great at this, and part of that's due to the fragmented nature of employment, which is very complex, but especially in an industry where provider burnout is often attributed, as we mentioned just a minute ago, to the day-to-day of their work. It's really about the hygiene of the workplace and how we make sure that people can get to work and have the tools they need to do great work.
Absolutely, that makes perfect sense. Thank you for that kind of broad picture overview. I'd like to peel back and go a bit deeper in some of those sections if you're open.
Yeah, that'd be great.
Yeah, so I know you've mentioned self-service, and I know the Digital Innovation Group's done a ton of work to enable this at Providence, things like online scheduling, smart assistants. Can you talk to me about some of the big successes there and what's still on the roadmap to be done?
Absolutely. Yeah, there's probably too many to mention in this, and I wouldn't want to forget some of the awesome work of my colleagues, but let me call out two. So first, the Providence and Swedish apps are really just phenomenal. You can get access to all your MyChart information, of course, that's like table stakes, but we have a ton of great work around same-day care, so you can just book a express care appointment, an express care virtual appointment right there to talk to somebody right away. You can find a doctor. There's a chatbot to help you navigate. There's great blog content in there now. It's a phenomenal one-stop shop. Its reviews are justifiably off the charts in Apple, App Store, especially compared to MyChart, which is not known as a great experience. So they've done a great job to make that experience great and make the self-service options there great, and certainly more on the way. The second one is our provider directory and online scheduling. You already mentioned this a little bit, but we build out our provider profiles with not just like name and photo, and you'd be surprised how many directories out there don't even have photos, but we try to really go deep and say, like, what makes for a great patient provider connection, right? How is your provider right for you? And so we, ask doctors about their practice philosophies. We ask them to tell us why they love practicing medicine. We record videos of them talking about what matters to them and how they want to provide care, and patients can get a really good sense of what their experience is going to be like with that provider. But then we also have the search capabilities, and the digital experience team has been phenomenal at this, so that when you have a particular health need and you're trying to find the provider who knows how to treat that particular condition, it can route you right there. You don't have to know the specialty name of otolaryngology, which I stumble over every time. I'm glad that I nailed that one. I think I nailed that one. Somebody will correct me in the chat, I'm sure. But just having that ability to say, like, oh, that's the doctor that I need to go see. And then you can book that provider with just one click, and all the appointment times are sitting right there like it was OpenTable. That's just a phenomenal experience. So it's not just enabling self-service, but it's making it a great consumer experience at the same time. And we save our front desk staff. We save them phone calls, we save them time, we save them logging. It's really a win-win.
Yeah. And just, as you mentioned, a fantastic consumer experience. I think how the team has thought about how we connect our providers to the consumer workflow and search for care, and how we, have syndicated our providers' information to really make it easy for consumers to get from search to that open table like experience you said, whether they're coming from Google or their payer portal. It's been a very consumer first view, and I'm loving to see it.
I'm super glad you brought that up, because I didn't mention it, but that is huge. So not only does that content power our websites, but we plop that content of the provider profiles as well as the ability to book on maybe your payer's website, or with a search aggregator or anything else out there, because the better access we can provide to the right provider, the better experience for our patients, and of course, the better our brand can really show up. So yeah, that's a great point. Patients don't just come to our website for search.
Right, absolutely. And then in terms of kind of that clinical support bucket, can you talk about what Providence has done with AI and that nuance ambient experience in particular?
Totally. I am a super nerd for this space. In fact, Providence and Dig has been piloting AI scribing technology since like early 2019. I want to say we partnered way back then with a little company at the time called Sequera, to do a small pilot of some AI scribing technology. That company went on to be acquired by Nuance. We have a huge enterprise relationship with Nuance. So all the stars really aligned to make this a really, really cool opportunity for us. But to back up a little bit. So this is AI scribing technology. So in a traditional visit, the provider will spend a bunch of time just staring at the computer screen. We talked about that a minute ago. It's like, it's notes for themselves. It's the templates they have to fill out. If anyone on the call has ever gone through a visit, and all the things you need to click, and all the notes you need to take, and all the words you need to make sure you use, it's a complicated form filling process, and one that providers really have to focus on when they're in the visit, and that sort of forces a screen in between the patient and provider and the relationship. It's been this way for a long time, and EMRs have come a long way. And there's a lot of great that comes from them. But there's that hitch in the middle where this fee-for-service environment and this one where we have to sort of tally every last little piece of a visit has come in the way of that visit. So Dragon Ambient Experience, which I think we all call DAX. We call it DAX. I think they call it DAX too. But so the provider's phone can serve as a microphone. It can record the whole conversation with the patient's permission in advance, of course. And then it will use natural language processing and AI to create the note and all the things that the EMR needs. So the provider, once they leave the visit, so they can sit and just talk to the patient face to face, no turning to screens, no typing. The provider can leave the visit and look on their phone or on the computer, and then say, review the note, make any edits they need to be making, and sign. So we piloted this. I don't remember the number of providers. It's in the report, but we piloted this with a number of providers and just saw some phenomenal early results. I think providers that used it more than 80% of their visits saw a 36% decrease in time and notes, which is huge. They also saw a big decrease in pajama time, which is what we call that time that a provider spends when they go home, they eat dinner, they put the kids to bed, and then they have their pajamas on, they get back onto the computer and finish up their notes for the day. And pajama time's the bane of providers everywhere. That decreased as well in these. That was a huge satisfier sort of target for us. I don't remember the exact percentage, but again, it's sort of in the report. But like, more importantly than even just the stats, like patients loved it, providers loved it. We're excited to potentially scale. It's been a really cool learning opportunity.
And I don't know if this was in the report because it was definitely more workforce focused, but do we have any idea of how, the folks in that pilot may have impacted like their overall kind of patient experience and engagement as part of that work?
I'd have to my team did not run this pilot. The wonderful folks over in informatics and corp development through the relationship with Nuance ran this. So I'd have to talk to them about all the details. But when we ran the Cara pilots back in the day, we saw improvements in both. So, excited to learn more. We're looking to expand this pilot pretty significantly over the coming years, probably. So lots of good opportunities still ahead.
Very cool. I think one of the meatiest areas, if you will, where we can think about digital's impact on the workforce crisis is around disruptive models of care. Virtual care is only a small part of that, yet there's a lot of talk about the increase of impacts, of course, on virtual care on providers and what using that medium has done to their lives and workflow, right? So what refinements need to happen in virtual care to make it a sustainable, care modality for providers as well as consumers?
Yeah, absolutely. And I feel every time we talk about this, I feel a little bit like a now more than ever. Like we've been saying this forever and ever and ever. And now it's, but it is. I mean, so what needs to be done? So the good news in all of this is that most of the technology that we would need to provide really good, sustainable virtual care exists. That's huge to have that, right? We're not reliant. There are so many industries where you're reliant on the next big technology to be invented in order to create amazing business. We've got the technologies. What we really need are the business models and the operational models to make this work. So on the business model side, I mentioned this already, but as long as a virtual visit is not reimbursed by insurance at the same rate as an in-person visit, which it was temporarily during the pandemic, and some folks are experimenting with it now, the economics probably aren't going to work out, right? We have to be able to pay for virtual visits at parity with their value at the very least, instead of it being a loss leader for most organizations. One way to do that is just to pay for them, certainly. But another one is going to be, to my earlier point, transitioning to value-based care. Because if all of a sudden you have a patient with multiple chronic care conditions, and instead of seeing them, once a month to check in on their chronic care conditions in person in the clinic, you see them twice a year, but you've got remote patient monitoring tools that are warning you if anything is out of whack with that patient. You've got regular digital check-ins. You've got a virtual visit now and then that's shorter and easier and just a quick check. You're able to care for that patient much, much, much better, much more in real time, while at the same time taking less overall provider time. The problem is today, that isn't paid for under traditional fee-for-service payment mechanism. So we need to really shift the model to do that. The other challenge, which is just a little more operational, is, we implemented virtual care overnight. And all we did was swap one for the other because we didn't have time to reinvent our business. We had to move to take care of patients. And so the virtual visit is structured the same way that an in-person visit is. We did a 1-for-1 swap. So I think it's time for health systems to kind of step back and say, okay, we now have this groundswell of adoption of both of our providers and of patients. It's super exciting. But we need to take a step back and reevaluate not just our technology, but our clinical and business processes to say, like, if we were to truly enable virtual, how would we design that process? And maybe it's starting with virtual clinics. Maybe it's a virtual first clinic. We hear a lot about virtual first health plans. I think it's a really exciting space. And so we need to switch a lot of those operational models and business models to get all this to work. But the technology is there, which makes it super, super exciting if we can pull it off.
I agree. You touched on a couple of these things, I think, just very quickly in what you just said, but there are some other big digital opportunities for transforming care delivery models like remote patient monitoring you brought up. I think, surgical pathways. Talk to me about some of those other solutions you're seeing out there.
Yeah, it's a fascinating time in terms of the solutions you're seeing out there, partially because we've seen a lot of funding dry up for a lot of healthcare startups really quickly after what have been a few boom years. Mm-hmm. So the technology that's out there is phenomenal. Like the companies that have raised a lot of rounds recently, some of them are really incredible. I'd be excited to see a lot of them really thrive, and I think a lot of them have a good chance. The question now is going to be, how can we kind of weather the storm a little bit? Health systems are financially in a challenging position. These startups, or some of them are larger than startups these days, but are in a financially challenging position. So we'll all need to really focus. And I think the way that we really need to do that is focus on the areas of care that we can show really solid and important ROI. And ROI measured not just in financial return on investment, but clinical return on investment, mission return on investment, and hone in on those. I think companies have been allowed to be a little more scattershot. And I think that this sort of financial challenge that we all see ahead is going to force us to really focus on some of those things. That said, some areas that I'm really excited about are, one, anything that's sort of a virtual first care model, whether that's virtual first concierge care, primary care, virtually enabled surgical care. I think with really good automated care pathways, combined with virtual visits, combined with remote patient monitoring, you can create a surgical episode of care that is just a phenomenal patient experience all the way through, as well as being like operationally great. We've been talking for a while about a sort of virtual primary care surgical medical home model. We think that would be fascinating to try to pursue. Another area would be around home care, including remote patient monitoring. So what would it be like if, a technician could pull up to your home, come in, set up for a virtual visit with your primary care provider, install, not just hand you and teach you how to use remote patient monitoring tools like a scale or a Bluetooth, glucometer, but also install a shower bar and identify things that were hard to reach and put them in a better place, and identify trip hazards and maybe help fix those. And then consistent check-ins, and that's a different workforce, by the way. That in-home technician would be a really interesting workforce, especially as we see home care as a space where we are going to be lacking some folks in the near future. But so anything centered around care at home, or distributed care, as we've called it in other places, I think those are two really big opportunities. The last one I already mentioned this earlier, but it's sort of my pet project, so why not? But payer-provider interoperability, huge space. I think payers and providers both kind of recognize the long-term animosity between their organizations through negotiations is we're kind of all done with it. We need to just partner and move on. So anything that helps create interoperability of the data between those organizations, and then helps serve it up in ways that automate processes and make processes easier for providers at the same time as they offer patients much more transparency and ease of access, I'm all for it.
Yeah, love it. Before we move too far away from talking about digital or virtually supported care models, we did get a question in the chat, kind of about the uptake of our consumers for virtual care here at Providence. Do you have any idea of a ballpark like percentage of our virtual care visits to the overarching picture and how it's supporting?
I'd have to check the stats. My recollection is that it settled somewhere around 12 to 15% of care from our physician enterprise. Okay. I'd have to confirm that number, but that's kind of the range that I think we're in.
Yep. And in the ambulatory setting, I know there's virtual on-demand care there as well that has a portion of that overall share of visitors too.
Yeah, exactly.
Yep. No, very good. Another thing the report touches on, there's a lot of talk about building a clinical gig workforce, if you will, to expand talent options and really level the playing field for supplemental staffing. What does a gig workforce do for Providence?
Yeah, it's a huge space, I think, because so this is really about bringing the flexibility of the gig economy to healthcare, and it's not just bringing it in terms of the hours that you want to work. I think that's a super important one that adds a ton of value to both providers and to health systems. But it also is about flexing across the locations that make sense for the providers and the health system. It's also about flexing across the care modalities that work for the patient, health system, and provider. So I think a lot of the things that we talked about in sort of the last question around care at home, around a virtual medical home model, those I think can be enabled so much faster if we can leverage sort of a gig style workforce flexibility into those models. So you could imagine somebody who is an RN who picks up at the hospital, who also picks up home care shifts and can go in and help assist in virtual visits or do a home visit, or there are a lot of great potential programs that I think could be enabled by this. I do think that, like, historically, our more rigid healthcare workforce, as showing up to the clinic, showing up to the hospital, still needed, in fact, in probably even greater numbers. But I think we need to find ways to bring that workforce to these other modalities and other care sites and other locations in order to enable more innovative care models.
Makes perfect sense. I know we're getting close to wrapping up here, so I want to just kind of put a bow on this. The impact of the Great Resignation is definitely concerning for healthcare. The report you and Doug Grafsky on your team put together really outlines some interesting and actionable thoughts for where digital can play a role, as you've kind of overviewed in our time together today. But as we close, I guess, what last words of advice would you give health systems and health tech innovators about how to help address this workforce crisis?
That's a great question. I think so. First, look inward, not outward. This is, and maybe it is, but assume it's not about COVID. Assume it's not about all these things that are external to you, right? Really look inward at your organization, at your processes, at your workforce. Take ownership and responsibility, and look for ways to improve the day-to-day, right? I think that a lot of health systems take the approach that, listen, this is a hard job. It's a hard workforce to try to manage. And all of these pressures and COVID and, burnout. But, let's be real, look internal and try to find solutions. I know our leadership, as you mentioned, is really doing a great job of this. So I really admire them for that. But I think we as an industry have been behind. Second, so this crisis won't get solved by money. There's no amount of money that we can throw to solve it, because the supply just doesn't meet demand. And in a world where our healthcare workforce supply is notably short of demand, paying more over here just means the caregiver from this hospital leaves to go to that hospital, and then this hospital is in a crisis. And we're just going to keep trading until hospitals go out of business. And that's going to impact primarily lower income, primarily rural, primarily low access facilities, which is bad for everybody. So we have to innovate our way out of this. We have to find new models to help superpower the caregivers we have to do the work. And we have to think about a way to practice, have folks practice top of license, get things off their plate that we can get off their plate, and extend their value and the great care that they deliver to as many patients as we can.
Absolutely. All right. Well, thank you, Matt, for joining in this really important discussion today. It was super enlightening for me. So thank you. And thank you to everyone else for listening in and sending in your questions. I know we didn't get to all of them, but our team at Providence will reach out on the various platforms where you submitted them and make sure you get your answers. You can download the full report on the workforce crisis and what digital can do at www.providence-dig.org/resources/workforce and innovation. And to learn more about our initiatives, programs, and services we have here at DIG, or if you're looking for medical care, please visit providence.org. And that's everything.
Thanks, everybody. Thanks, Kayla. Yeah. This was great.
Thank you, Matt.